All right, thank you all for joining us today. We're joined by Mr. Greg Wolf, and he is going to be answering all of our questions about getting started, entering our data into Pond. And so this is a rather informal presentation. So if you have any questions or concerns, feel free. You can unmute yourselves, or I'll be watching the chat. But again, this is more of a user webinar. So with that said, I'll turn it over to you, Greg.
Thanks, Laura. And just to reiterate Laura's introductory comments, I have maybe 3 or 4 minutes worth of slides just to sort of set the table. And then what I thought I would do is share with you a bunch of reports that you can generate through the program. And then I'll pull up the site and I will make myself available to answer any questions that anybody may have about the pond system. Part of the reason we're doing this relatively informal webinar is we have, I think, 17 different clinics that have enrolled in Pond. Some of them have got all the required data in on one end of the spectrum. On the other end of the spectrum, we've got clinics that have enrolled but haven't really put that much data in. So we figured this would be a good chance for us to do a quick overview of how it works and then answer any questions that people may have. Our goal is to get first all 17 of the enrolled clinics fully with the full data set entered so you can generate your reports and then start the process of adding onto that initial 17 clinics. So let me talk at you for just maybe 5 minutes, and then I'm going to show you some of the reports, the output, the value that you will get from your work, and then we can just have a discussion. And this will go better and faster the more interruptions people have for me. So feel free to just jump in whenever you want. All right, so real quick, what we're doing in Oklahoma is very similar to what a bunch of states are in the process of trying to set up, which is the natural evolution, I would say enhancement, of critical access hospital performance improvement programs so that they start to include rural health clinics, because in most parts of rural America, primary care is offered through rural health clinics, and the majority of those rural health clinics are owned and operated by small rural hospitals, of which the majority are critical access hospitals. And so what we're trying to do at the state office is to build a platform for performance improvement for all of the over 60 rural health clinics in Oklahoma. What you see on this screen, this is generally our starting point in terms of a performance improvement curriculum. I know we've already had a kickoff webinar. We talked about the legislative updates with the RHC Modernization Act, and then our next webinar is going to focus on contracts and compliance, and that'll be with Opal Greenway from Stroudwater. And we'll just work our way through these topics and build out the curriculum and the technical assistance that we want to offer through the network. But what we're really trying to do as a first step is to build a data platform, because we learned last December with the Modernization Act that in an information vacuum, typically bad things happen, especially to rural providers, and in this case, rural health clinics. So rather than sitting back and waiting for the next set of bad news to come our way, why not start collecting data and start showing how good rural health clinics can be? And that's one of the pieces of the puzzle for why we're working on this project in Oklahoma. The platform for us to do that work around the data is called the Practice Operations National Database, or POND. And that's what I'm going to show you in just a minute, is some of the reports that you can get from Pond in exchange for 20 minutes of your time, one time per year, to put data into the system. So real quickly, Pond's got two parts, and I'm going to show you some actual reports in just a second. One side deals with publicly available data. Most of that comes from your Medicare cost reports. The other side is a little more challenging, because we're asking you to do some work up front, and then you'll get the payoff. But that's providing data one time per year so we can fill in the gaps on the data that we think are really important, but you can't glean from the publicly available Medicare cost reports. So I'm going to show you all of these reports in the vivid real colors in just a second. But that's what we're talking about, is we're asking you to provide us some information, and we'll hand back to you a ton of reports and benchmarks as soon as you do that. Got a growing list of states that are working on this, so that's good, because as we add more states, we add more clinics, and then the database becomes much more valid and useful. So we're moving in the right direction, and we're onto something here, but in Oklahoma, we're really focusing on getting that data platform built. This may be the most important slide, because we're going to have a conversation this morning for a half hour. We'll answer some questions and all that good stuff. Everything that you need to know about how to enroll and organize your data, put your data into the system, and then generate the reports, all of that is covered in an online video. So if you come out to this link, you'll get these slides. You can fast forward and rewind and go over whatever you want to see to make sure that you're using the website correctly. So this is a really important one, and this is available to you now, and this is where I would encourage you to start. Whoever is going to be responsible for putting data into the system should go out and watch this. I think it's 28 minutes long. But again, you can just fast forward through anything that you don't want to look at. But this is an important piece right here. And then we always like to end with what's next. So this is my last slide. If your clinic is not already enrolled in the Pond web application, we want you to do that. Get your data into the system so you can generate some reports. This work that we're asking you to do really serves two purposes. Primarily, it's to provide you new insights into your clinic or clinics, and to help you identify where the performance opportunities reside. But there's a second purpose to this, and it's sort of a good citizenship purpose, which is the more clinics that use the system, the better the database, and the better it is for Corey and Laura and folks from Starwater and LilyPad and the compliance team to really try to zero in on what are the areas that are most worthy of improvement. So we're asking you to do it for your own edification. We're also asking you to do it to be a good citizen and a good partner of the Office of Rural Health. All right, so that's really my last slide. Now I'm going to change my screen share, and I'm going to start showing you some of the reports that we can generate. Actually, I lied. You know what I'm going to do? I think I'm going to go out to the web, and I want to show you the web application real quick. So let's get rid of this, and we'll go here. Alrighty, Laura, did it work? Do you see the Pond login screen?
Yes.
Okay, good. Alrighty, let me show you what this looks like, and then I'm going to show you some reports. So bear with me for a couple of minutes. So what I'm going to do is, all right, so let me back up. It's a secure web application website. Every clinic will have a single user. You can enroll your clinic and enroll yourself as the user, as 17 of the clinics in Oklahoma have already done. So you can log in and use the tool anytime you want. Let me log in, and this will be a demo account. So this is not going to be real data. This is just for purposes of showing you what it looks like. So let's see here. Okay, and I'm going to log in on my demo account. Okay, and I'm going to say, yes, I agree. Now I'm going to sign in. All right, when you log into Pond, it'll look pretty much like this. If you have more than one RHC that's part of your organization, you can enroll multiple clinics. You would do that by clicking on this tile, oddly enough called I want to enroll another clinic. That process will work the same way. For this demo account, we've got an Eastern clinic, and then I can switch over to the Western clinic, and then back to the Eastern clinic. So you can line up for a single user, multiple clinics as part of your organization. And in Oklahoma, there's all kinds of critical access hospitals that have multiple rural health clinics. And I know that because we can look at the cost reports and see that there's not that much consolidation for critical access hospitals that have multiple clinics. Anyway, this is generally what it looks like. I'm going to walk through each of the data input panels, but I'm going to do it at a very brisk pace, like maybe in a minute. And then I want to show you the payoff, what you can actually get out of the system. So the first thing we're going to ask you to do is tell us about your clinic. And the most important thing there is what kind of clinic you are. Most of you on the call today will be provider-based rural health clinics, but if you're an independent clinic, you would select that. And then we've got other information. This only gets updated one time. And even as you do this in multiple years, it's likely that this isn't going to change. So this is a quick one. This shouldn't take you literally more than a minute. Then we move on. Again, this is for fiscal year 2019. And what we're doing here is we're asking you to tell us how many FTEs did you have in this specific clinic site, this clinic site. The numbers will automatically update. If you have any questions, you can mouse over the little I button. It'll tell you exactly how to calculate it, and then you're off and running. Then you go to the next panel. Performance is really financial. You can see we're asking for 4 inputs here. You should be able to get this from your hospital CFO, or if you're an independent clinic, you should have that at your fingertips. Just look at the last fiscal year. This information should be in your audited financial statements for the last year. So those are the only panels for the full clinic itself. Now what we're going to look at is zeroing in on individual providers. So by providers, what I mean is your advanced practice providers as well as your doctors. And you build your roster by typing in here the 10-digit MPI for your nurse practitioner or for your PA or for your doctor. Once you type in that 10-digit number, it'll present a button. We'll go out to a national database and download information about the provider who's assigned that MPI. But I've already done that for this demo account. We've got 2 internal medicine docs and a nurse practitioner. And I can click on the name here, and you can see that we're asked for clinic hours per week. So this is very straightforward. Again, 1 time per year. I'm not going to save that. So this provider roster is the first setup. Now that we know your providers, this is an optional piece, but if you want to track your quality measures, these are the 5 quality measures that have been deemed to be the most rural relevant. And so we ask you to collect those on an individual provider basis. Go on to the next panel, and I'll pull up Dr. Braun. And so we want to know is the base salary range, how much bonus Dr. Braun got in the previous full fiscal year, and then some of the variable compensation information. We're asking for this because what we want to do is we want to create for you, especially the CEOs and CFOs, a rural specific, RHC specific database. So you can start to understand how to both size and shape compensation programs for those PAs, nurse practitioners, and doctors who choose to practice in rural health clinics. And right now we don't have much data like that, but we're starting to build out that database. We do that because we're trying to get and asking rural health clinics to provide that information. So this is how we build that database that'll be very important to you in the future. Next panel works the same way, but I'll pull up the nurse practitioner. So this is productivity. So we want to know panel size, patient visits, new patient visits, and annual work RVs. You'll notice that a couple of these have a little asterisk next to them. The asterisk denotes that it's a required field. So if you wanted to blow off, for example, new patient visits or you don't track panel size, by the way, you should. Well, let's just say you don't. You can leave those blank, but we do need you to provide the patient visits and the work RVs. And everybody always has those. So that shouldn't be a problem. Okay, we're done. That's the data collection we want you to do. The land speed record, I think I've reported to you before, is 12 minutes. There's a clinic in Iowa that went from enrolling their clinic and generating their report in 12 minutes. 12 minutes 1 time per year. That's our ask. Doesn't seem like a lot, but let's move forward. Now that you've done that, now we can start talking about the payoff. So as soon as your required data are entered by your clinic, you can come out and you can start doing a bunch of different things. I'm going to start showing you the payoff here. So you will see as a white dot in this interactive candlestick for each of these measures here, The white dot is your clinic, so that'll literally be the data that you just put into the system. The left edge of the candlestick is the 25th percentile. The right edge is the 75th percentile. And then the vertical purple line, that's the median. So what we're saying is gross charges per total staff, your clinic was $118,095. Then you've got the 25th percentile is 121, the median's 148, the 75th percentile is 180. All you need to do is mouse over any of the candlesticks and you get your summary statistics. If you want to do that for productivity, it's the same idea. So you can select the domain up here and then you can mouse over. So that's the little interactive widget that we've created, because what we want to do as soon as you put your required data in, we want to give you something back instantaneously. And so that's how we do that. And we shape the benchmark pool based on the characteristics that you gave us through that very first panel. Now, the second thing you can do is you can download a summary report, and you can also download a cost report scorecard. So I'm going to change screen shares. I'm going to start showing you the PDFs that we can generate. So let me go up here to new share, and here we go. How did I do, Laura? Do you see a new screen?
Yes, good.
Well, it's only taken me 18 months, but I'm starting to get the hang of this, I think. All right, so here's the first of 4 reports I'm going to show you. So again, we're asking for 20 minutes of your time. Now we're looking at new data that I'm all but certain you don't have access to, but you do today. Let me zoom in on this a little bit. So here's your PON summary report. This is the one report that comes from data that you've given us and that we provide you benchmarks from other clinics that have given us that data. So again, this is not cost report data. This is data that has come from your peers across the country that have provided that data through the same web app that I just went over. So I'm going to go through these real quick because I want to make sure we have time for questions. We organize them into staffing metrics, and you can see that you've got your clinic value here. And then in this case, it turns out that we're looking at Region A, which is the Northeast. These are your median values for your benchmarks. We look at staffing metrics, performance, which are really financial metrics, productivity, compensation, and then quality metrics. That report, this report that I'm showing you is literally available to you right now. You've got to enroll your clinic, put in your required data, and the web application, the machine will literally spit out this report. But once you do that, you also get access to a couple of other reports. Let me go through those real quick. So the next one that we think you'd like to look at, and by the way, this is all publicly available data, and we have permission from this hospital in Nebraska to share this information. So this one's a nice 3-pager. So you've got your title page, you've got a bunch of data, let me zoom out on that. You've got a bunch of data on page 2, and then we actually describe for you exactly how to calculate all the metrics. So this one's going to give you a trend. All right, so it'll say your clinic up here and your CCN, and then a little bit of information about your clinic. Then we're going to give you some trending data. So we say, okay, tell us about your last 3 years. And then we've got your benchmarks. Now, in this case, it's Nebraska. What you're going to see, obviously, is Oklahoma. And Laura, are you guys Region C or D? I can't remember.
We're Region D, and we don't talk a whole lot about Region D on our calls, but just for comparative reason, or just for comparison, Region D consists of Arkansas, Louisiana, Oklahoma, Texas, New Mexico, Arizona, Nevada, California, and Hawaii.
Thank you. And I guess Hawaii had to go somewhere, so they went to Region D. So that's your regional. So you get a state, a regional, and then a national benchmark for all of these metrics. So we look at cost per visit and then adjusted cost per visit. Now this will reveal to you whether or not you met your minimum productivity standard. Now this clinic happens to have done that for the last 3 years. So you've got zeros here, which by the way is why you also get a 0 here. Because what we do is we look at your total cost for Medicare and compare it to your reimbursement for Medicare. And because they met their minimum productivity standards, they've got a zero value. Sometimes we'll see a pretty big number here, and that's because you get clinics that are not meeting the minimum productivity standard, which means that they're not really getting full cost-based reimbursement. So we like to see a zero here. And then down here, we break out a bunch of provider metrics. And again, this is specific to PAs, NPs, and doctors. And then we roll them up. In some cases, we roll them up into primary care providers as a bundle. So I'm going to keep going through this relatively quickly because I'm sure everybody on the call later this afternoon, you're going to be able to look at this report, but it's going to have your data and your benchmarks. Let me go to the second report. This is another quick one that's available to you, but this is the LilyPad Awards ranking report. So what we've done is we've identified 5 really relevant and important metrics for all rural health clinics in the country, and we've run the numbers. So you've got the actual score for your clinic, and then where you rank relative to your peers, and then your percentile. Then you will get a national rank and a percentile score. So this is based on every rural health clinic in the country, and we've run these numbers for the most recent cost report period for each clinic in the country. So you'll be able to get your rank and percentile later this afternoon. Okay, next report. This is one that you're going to have to request from Laura, but she's not going to give it to you until she knows that you've got your data in the system. But I like this report because it actually gives you a little bit of extra information that I think is pretty good. So here again, you'll see your 3 years of trends. You'll see some additional metrics. These are based on your LilyPad awards, as well as some of your key statistics in terms of volumes and staffing. And then this little part in the middle, I really like. So this is what we did. When we were in the process of building the LilyPad awards, we said some of the data are just not valid or reliable. I mean, it's just plain wrong. People didn't fill out their cost report correctly, or they forgot something. So we built 29 data integrity checks. So our data warehouse will go out and scan your cost report and look to see if we got a reasonable, defensible number based on 29 different ratios. And if you had an error in any of those 29, we're going to tell you what problem you had, because you should probably hunt that down and figure out why you've got an issue with your cost report. Now, for Lexington Regional, they only flipped one of the 29 data integrity checks. It happened to be number 9. Now, on page 3, it'll tell you what this is. So if you flipped 3 of those data integrity checks, you'll have 3 items listed here. This one says incomplete. Physician assistant costs were provided, but their FTEs were not included. So the question would be, well, why do you have costs in your cost report, but you didn't track your FTEs? Now, the answer is they probably bundled nurse practitioners and PAs together on their FTEs, but not on their costs. So that's just sloppy. And that very often is a signal there's something else that's going on in terms of tracking costs or FTEs that's worth looking at. Anyway, this report will be available to you. The goal is to not have any red here. Lexington had 1. Here's your LilyPad rank and percentile. And the last little piece down here is we're interested in Medicare beneficiary out-of-pocket costs. So what we've done is we've gone into your Schedule M's where we look at, okay, how many visits, what were your costs, what was your reimbursement, and then 20% of charge. 20% of charge, not cost, charge, that's the problem. And then what's the coinsurance deductible, and then we add them up together. So every time a Medicare beneficiary in Lexington goes to the Lexington, Nebraska provider-based rural health clinics, it's $44 out of pocket. I'll tell you that's because their charges are too high because they haven't been curating their charge master in a strategic way. Completely different topic, something we'll get to as part of this network, but that's an FYI. So Laura, with that, I'm done talking. I'm ready to take questions, but that was speed dating of the highest order. I've got 1225. We just covered a lot of ground, and I'll be very I'll be very specific and very direct to the folks who are on the call. We want you to go out and enroll in Pond and put your data in the system. It will make the network much, much better and will give you a much bigger, better peer group for you to learn from. We can't do that for you. We need you to do that. We're asking you to do that. All right, that's my sales pitch. Laura, let's see if there's any questions.
We do have someone with their hand raised. Doug, are you able to unmute?
Yes, I am. Do you hear me?
Yes.
So we have a fairly significant number of clinics that we file, but we file a consolidated M series. So how do I input all of those clinics individually with similar numbers, or how do I do it?
Yes, every one of your individual sites should be used to enter data into Pond. So let me just flip over. You're going to click on the I want to enroll another clinic. Even Doug, even though you consolidate, how many clinics do you have? 5, 6, 10, 12?
There's 13, and then within those, there's some suite set up. So there's like 18 clinics in total.
Yeah, so
there's only 13 actual RHC provider numbers. So.
Gotcha. And on your S2, I would only see one hosting RHC, and you consolidate all 13 under that one?
Yeah, we file one set of M series, and we list all of the individual clinics on the cost report that make up.
Gotcha. Okay. Yep. Okay. So here's what you're going to do. Any report that you either receive or generate based on cost report data, you're going to have a single consolidated report that brings all that together, because there's no way for us at LilyPad to disaggregate all those statistics. Medicare gets it as a consolidated. We can only hand it back to you as consolidated. That's on the cost reports, and we prepare all those automatically for you. Nothing for you to do there. On the Pond side of things, we're going to ask you to set up each of the individual clinic sites based on their individual CCNs. And that's so that we can actually track the individual sites, which generally tends to be really helpful to you, Doug, because we want to encourage you as a best practice to be tracking your statistics and profitability, and really ideally quality, on an individual clinic site basis. So that's a nuance there, where in the data collection tool called Pond, each individual RHC site that has an MPI and a CCN, we want that specific data. All of the cost report-based reporting that you will get, that will be consolidated benchmark data.
Okay. Yeah, we track and report we report each clinic separately, even on our financial statements. The consolidation helps dramatically in the productivity area, and it also helped us in that we have a pediatric clinic that doesn't have any Medicare visits, and we needed a rate letter to get Medicaid reimbursement. So kind of the rationale behind all that.
Good for you, Doug, and that's the best practice. Way too many critical access hospitals consolidate, and then they do all of their internal reporting with consolidated. It's not a level of detail that gets you the precision you need to manage those clinics. So good on you for building your financials around those. That's exactly what we would encourage you to do.
Thank you.
All right. Do we have any other questions or hiccups that folks have ran into while entering your data?
Would you mind putting that website up again that shows the that you had at the beginning? I didn't get all of it listed. The training.
Do you want the tutorial?
Yeah, the Vimeo.com. I didn't get all the numbers on it.
Yeah, so let's go here. And Laura's going to get this slide deck, and she'll send it around as well.
Okay, that's all I need. Then if you send that, that's fine.
Yeah, it's probably easier. You don't want to jot this down.
Yeah, I'll get this sent out. And then also we're recording this session too, and we'll get it posted and sent out too.
Okay.
Laura, before we hang up, do you want to put another plug in for the upcoming webinar with Opal? Because anybody who's on this call, you should definitely log into that, because as we can all appreciate, setting compensation packages for providers is really important. And then the other side of that coin, the compliance, is equally important. And Opal is a national expert. This is a free webinar. And anybody who's on this call should definitely join that call as well.
Yes, and that's scheduled for next Wednesday, May 12th at noon. I'll be sending out the registration link. It's just like this webinar. There's no cost to attend. We just ask you to register to access the connection information. But I'll be sending it out along with a reminder for folks to join us. But yeah, Opal, she did a presentation for the critical access hospitals, and it was great and very, very informative.
Laura, one last comment I forgot to mention, and it may go to Doug before anybody else. Anybody who puts all the required data into Pond, if you want to set up a call with me and spend a half hour looking at your actual data and talking about how to really think about the interactivity of the different metrics and what it means, and then how to use the benchmarks, I'm more than happy to set up a call with any Oklahoma rural health clinic that would benefit from just having a chat about how do you use these reports. Happy to do that.
All right. Well, thank you, Greg, for your time, and thank you for walking through Pond with us and showing all the beneficial reports that can be generated. Again, folks, we did record this session. If you have any questions or concerns, please let us know. If you run into any questions, please let us know. Also, I'll be sending out these slides along with this link right here, as well as the registration link for our webinar next week. So thank you guys, and y'all have a great rest of your day.